I'm Debra Schutte, a professor here in the College of Nursing and also serving as Associate Dean for Faculty Affairs. My program of research has been spanning about 2.5 decades now, but a common thread through all of it has been my desire really to engage in research that improves the health and quality of life of older adults, and particularly older adults who are experiencing age-related cognitive declines like Alzheimer's disease. I had the good fortune of being a graduate student during the time of the Human Genome Project, where we were, the buzz was all around mapping and sequencing the human genome. And the scientific conversation at that time was, how do we use this information to predict disease and so that we could intervene? Well, how can we use these technologies to better understand health problems for which nurses intervene? And then how can we use that information to more effectively develop interventions and improve outcomes? In my case, I was interested in the common behavioral symptoms associated with dementia, things like anxiety, agitation, and depression, and thinking about how we could use genetic technologies to better understand those health problems. And so my dissertation really focused in that area of integrating genetics into the care of persons with dementia. But all along, too, I've been interested in, not only the genetic aspects of disease, but the interactions between genes and environmental factors. And that's really what drove the kind of migration of my research into more of a community engaged space. So developing a community partnership with 3 rural villages in the state of Michigan to provide a platform for us for looking at the relationship between genetic factors, environmental factors, and lifestyle, and to better understand those interactions and their influence on disease, symptoms, and how those things evolve over time. In this case, I came into that relationship thinking about Alzheimer's disease as a common health problem, but through a needs assessment with the community, we identified with them that age-related hearing impairment was really a primary health concern in that community. So that shifted our research focus a bit to think about how we could assist the community in handling some of the impacts of age-related hearing impairment on individuals in those villages. From the early work with genetics and Alzheimer's disease in particular, we were working with pretty early genetic technologies at that stage. But I think we did contribute to proof of concept that genetics can influence behavioral symptoms. We did do studies where we identified specific common genetic variants that were more common or impacted either the frequency or severity of behavioral symptoms in persons with dementia. I also was doing some collaborative work at that time with persons studying chronic pain in older adults. And we also were able to identify common genetic variants that influence severity of pain and also moderated the effectiveness of non-pharmacologic intervention. So those were really important, I think, proof of concepts, why it's important to be thinking about these type of variables and how it can help drive nursing research. In the community space, over a period of 10 years in working with that community, we did work with them to develop a church-based intervention in the community to help them integrate a large area assisted living device, do that in a really kind of multi-component comprehensive way. So not only putting the device in the church, but providing education to church members about how to take advantage of that device, using a lot of communication strategies, almost social marketing kind of efforts with the community, trying to take away some of the stigma around using those type of devices. I think there's so much capacity to continue that kind of work and to be doing that type of research that produces data that can drive clinically based decisions and help us better develop personalized interventions for persons with dementia. There's still so much capacity in that area to do that. I think more broadly, with transition in my work to the Associate Dean role, I really see my important contributions going forward in the research space and building a culture and environment that helps our next generation of nurse scientists be able to do their work and continuing the amazing work that they're doing.